nurse today. Can you please tell me your name?
Hayden.
Hayden? Okay, Hayden. Nice to meet you. How old are you?
17.
17. Okay, this is my 17-year-old brother, and his name is Hayden, and today we're going to be doing a head assessment. So with the head assessment, we're going to be looking at your ears, eyes, nose, throat. We're going to be looking at your lymph nodes. We're going to be taking a look at your hair and all that good stuff.
All right.
So I have performed hand hygiene. We're just taking a general overview of the patient. He's alert and oriented. He's looking at me. He's talking to me, and he seems to be cognitively stable. So that's great. So what we're going to start off by doing is we're going to have him smile. Can you smile real big for me? Good. Okay, close that smile. Perfect. I'm going to have you puff out your cheeks. Good. Okay, we're noting facial symmetry. He is symmetrical thus far. I'm going to have you raise your eyebrows. Good. Put him down. He has good face control. We also have symmetry with the eyebrows. Okay, so I'm going to have you look to your right. Good. And I'm going to have you look to your left. So when I'm doing this, I'm looking for any lesions, any bumps, any scarring, any areas that might be off in color. Do you have any areas that are tender or painful when I touch your face, just like this?
Not that I know of.
No? Okay. We're not looking and seeing any bruising, so that's great. Okay? So what I'm going to do is I am going to go ahead and inspect your scalp.
Okay.
So with that, like I said, I performed hand hygiene. We're looking at the thickness of the hair. We're looking at the hair pattern. We see that he has a full, thick head of hair, and we're going to inspect starting from the front to the back. And for time's sake, I will speed this up, but we're looking for lesions. We're looking for nits, so I would be wearing gloves. And we're just picking apart the hair. We're looking through it. We're also feeling. You would feel for any bumps, any swollen areas. Not noting any of that, so that's great. Okay? We're not feeling anything on the sides either, so that's good. Perfect. Okay, so when I do the hair, I also want to take a look at the eyebrows and the eyelashes. We see that he has full thickness in both brows. That's great. We also see that his eyelashes are full. We've noted that he has good hair pattern on the face, so that's great. And we know that the eyelashes are pointed up on the top, and on the bottom they come down, so that's great. All right, so now what we're going to do is we're going to palpate what we call the TMJ, or the temporomandibular joint. So what I'm going to have you do is I'm going to have you open and close your mouth 3 times for me, and I'm going to palpate right here on the face, okay?
Okay. All
right, go ahead. 1, 2, 3, okay? And when I do that, I'm checking, we're feeling for any clicks or anything that sounds off. Do you have any pain or tenderness when I touch your TMJ?
No.
No? Okay. Do you hear any clicking?
Nope.
No? Okay, perfect. So that's good. So what we're going to do now is we're going to take a look at the ears. When we're looking at the ears, we are looking at the outside of the ear. We're inspecting the ear size and shape. It's symmetrical. Just like the head is a good shape, good contour. Okay? All right, and then we're looking at the outside of the ear. Now, I'm going to touch his pinna. Tell me if you have any pain or tenderness when I do that.
Nope.
No? Okay, we're doing the earlobe. All right, we're looking at the tragus. All right. We're also going to palpate back here. Do you feel any pain or tenderness back there?
I don't.
No? Okay, good. So when we do an inspection of the ear, if I was to have an otoscope, I would actually pull the pinna of his ear up and back. In individuals 3 and up, you do pull the pinna up and back to be able to visualize the internal ear. And with those 2 and younger, you would pull it down. And that just helps to visualize the tympanic membrane, because in little people, the structure of the inside of the face is a little bit different than it would be in an adult. So I just wanted to note that. Okay, so what we're going to do is we're looking for any drainage, any swelling of the ear canal. And actually, let me grab my light. I can visualize the outside. All right. Slight bit of earwax. I don't note any drainage or any swelling in the outer portion of the ear canal. That's great. And if I was to use the otoscope to look at the internal portion of the ear canal, I would note any redness, any swelling, any exudate. We don't note any of that from the outside, so that's good. But if you were to visualize the tympanic membrane, you would want it to be a pearly gray. You would want it to have a slight indentation in the center, and you would be looking for something called the cone of light. And in the cone of light, when you illuminate the inside of the ear, you should be able to see it in the left ear at the 7 o'clock position and in the right ear at the 5 o'clock position. Okay? All right, so what's next? So now we're actually going to take a look at the eyes. And when we take a look at the eyes, we're looking to assess. He's looking at me. We see that he's got pretty symmetrical movement, but we're going to test it, okay? So what I'm going to have you do is I'm going to have you look at my pen light, okay? All right, and we're going to be assessing the movement of your eyes. Good, good accommodation. That's great. All right, and I'm going to have you look at my pen, and I'm going to go up and down. Okay, bring it back to the center, side, side. You're doing great. We're going to go diagonal, okay? Good. Good. All right, so we do see that he has good symmetrical movement with both eyes. He has good control. Okay, so now what we're going to do is we're actually going to continue assessing our PERLA, pupils equal, round, react to light, and accommodate. We see that they do accommodate. Well, now we're going to test that reaction reflex to light. So we're actually going to be looking at the left eye. What I'm going to do is I'm going to bring my pen light in from the left. Okay, let's dim the lights. All right, I'm going to have you look at me. And I'm just going to bring it in from the left. Good, we have good pupillary constriction. Okay, now what we're going to be doing is we're also going to be looking for brisk constriction when I shine the light in this eye. It's called consensual constriction. We want to see that right eye constrict as well, okay? So what I'm going to do is I'm going to cover the middle of his face with my hand, and I'm just going to bring this light in from the left, and the right eye should constrict as well. Good. Okay, very interesting. It did constrict on that right side also. Okay, so we're going to cut the lights back on. Good. So now what I want to do is I'm going to don some gloves actually, and we're going to take a look at the puncta on the inner portion of his eye. We'll be looking at the conjunctiva, the sclera, and we're going to note how those look, okay? I'm donning some gloves. All right, now that we have our gloves on, we're going to take a look at the eyes. So what I'm going to do is I'm going to actually pull down the conjunctiva very slightly. These are the bottom portions of your eyes. We know that they are pink and moist, which is great. That's what we want to see. We're also going to look at the puncta. So we see that we can visualize the puncta, and it is patent. So that's good. We're looking at the eyelids. I don't notice any swelling in the eyelids, which is great. That's what we want. And we're looking at the sclera. The sclera are white. Okay? All right. Now we're also, overall, PERLA, we would say he does have PERLA. His pupils are equal. They are round. They react to light, and they accommodate appropriately. So that is good. Okay? So now what we're going to do is we're actually going to go ahead and I'm going to do the hearing test. So what I'm going to have you do is I'm going to have you cover your left ear.
All right.
Okay, you cover your left ear. And I'm going to whisper a 2-syllable word, and I want you to repeat it to me when I ask you, okay?
Okay.
All right. 99. Okay, can you tell me what I said?
99.
Okay, go ahead one more time and cover that ear. I'm going to repeat another 2-syllable word. 33. Okay?
33.
Okay, good job. So he did great with the whisper test. Good job. All right, so now what we want to do is we've looked at the scalp, we've looked at the ears, we've looked at the eyes, we've checked the function of the eyes, the ears, all that good stuff. So now we're going to move on to the nose. We're going to be looking at the septum of his nose. We're noting the outside structures. So if you want to close your eyes, you can. Okay, so we're looking at the septum. We know that the septum is even. We don't see any uneven distribution, so that's good. So now we're going to look up into the nares. Okay, we notice that the nares are patent. We don't note any swelling or drainage in the nares. And if I had a scope to be able to look up inside of his nose, I would be able to actually visualize his nasal turbinates. And I do not have one of those, but if we were to look at his nasal turbinates, we would want them to kind of be a dark red, but you want to look for any swelling, any discoloration, any bluish or maybe even purple discoloration of those. And you also want to just check for any exudate, or in this case, you know, snot, anything like that. So we don't note any of that from the lower nasal passages, but when you assess the septum, you also want to look for any holes, and we did not note any of those either, so that is great. Okay? How you doing?
Good.
Good. Sounds good. So what we're going to do now is we are going to actually palpate the neck. So what I'm going to be doing is feeling for your lymph nodes, okay?
Okay.
So with that, I'm going to just go ahead and feel, and I'll name these out loud. We're feeling for your preauricular, post-auricular lymph nodes, and I will note if there's any swelling or tenderness. You let me know if you feel any pain, okay?
All right.
All right, pre-auricular, post-auricular, occipital. Still not noting any swelling, and I don't feel any hardness, okay? And we're also going to feel under here, okay? Get a good feel on those. Good. We're looking at your submandibular, submental, okay? And we're also going to look at your cervical chain, posterior cervical, supraclavicular, and we also have your tonsillar lymph nodes up under here. So do you feel any tenderness or swelling when I palpate any of these?
I don't.
No? Okay, great. Sounds good. So what we also want to do is we want to take a look at the neck. When we look at the neck, you can look at the back as well as the front, but the structures we really want to focus on will be in the front. So I'm going to have you look up a little bit for me. Okay, and what I'm going to do is I'm actually going to feel with my 3 fingers. We're going to be feeling for the trachea. We want to make sure it's midline. Okay? So we're just feeling the trachea. Sorry if it tickles a little bit. Okay? And we do see that the trachea is midline. All right, and we're also going to be palpating for the thyroid, so I'm going to reach my right hand on the back of your head. Noting that tracheal cartilage. Okay. And the thyroid gland is non-palpable. Okay. All right. Still doing okay?
Mm-hmm.
Good. All right. So before we move to the mouth portion, I actually want to assess his range of motion in his neck. So what I'm going to have you do is I'm going to have you look down. I'm going to have you tilt your head back and look up. I'm going to have you pivot your head to the left. Pivot your head to the right. All right, and I'm going to have you touch your right ear to your right shoulder, if you can. And then we're going to try to touch your left ear to your left shoulder. Good. Excuse me, good. Do you know any pain in the neck when you do that? Is it hard to turn your neck?
No.
No?
All feels good.
Good. Okay. So now for this next portion, we're actually going to move to the mouth. So I'm going to grab my tongue blade. Okay. And with this, I'm just going to take, actually, we're going to know the outside of the mouth first. So what you want to look at is this vermilion border, and certain viruses actually like to have lesions show up right there on that vermilion border, and we do not note any lesions on the vermilion border, which is great. So we're actually going to be looking at the inside of the mouth too now. Okay, so I'm going to have you turn your head forward. I'm going to have you relax your mouth and lips. Relax. Okay, we're looking at this bottom lip. We don't notice any lesions. Do you have any tender areas in your mouth or any ulcerations that you know of? Okay, we don't know any ulcerations or anything like that. So we're looking at the top. We note that the inside of the mouth is pink and moist. The lips are pink and moist, which is great. We're actually going to open up. Let's see, and I'm going to visualize on this side. Okay, we're looking on the inside. It is pink and moist. I'm looking at the inside of your mouth. I'm also going to look at your gum line. Okay, you doing okay?
Mm-hmm.
Good. We're looking at the teeth. Okay, looking at the gums. Gums look good. Okay, I'm going to have you stick your tongue out for me. Stick it straight out. Okay, and we do see that the tongue is midline, which is exactly what we want. We want it to protrude evenly. I'm going to have you wiggle it side to side. Okay, not quite that intense, but we do have good tongue control, which is good. Okay, we don't notice any tics or any abnormal movements with that. Okay, I'm going to actually have you open your mouth real quick for me. Okay, and I'm going to have you put your tongue in the roof of your mouth. Good. Okay, and you can shut your eyes for me. When we look at the bottom of the mouth, we actually want to note the frenulum, and the frenulum is visible. And we're also looking for those Wharton's glands on either side of the bottom of the tongue by the frenulum. We don't see any of that. We do note Wharton's glands at the bottom of the mouth. Good. All right, stick your tongue out for me. All right, and I'm going to just visualize the back of the throat. So you shut your eyes and say, ah.
Ah.
Good. Okay. So with that, when we look to the back of his throat, we do note bilateral raising of the sides of the back of the pharynx, which is good. We also note that the uvula comes up as well. And we see that it is midline, it remains midline, so that's good. We don't note any swelling with the tonsils. We don't note any redness. We don't note any abnormalities. Okay? All right. Well, how was that assessment?
You did well.
I did well. All right.